of advances made in the sciences of chemistry and physics, and in the fields of medicine and public health, and in the social sciences and technology, the duties and responsibilities of nurses have changed.
Duties that have not been assigned to nurses are now being performed by them. With progress and expanded activities naturally came added responsibilities, both ethical and legal in nature.
Everyone is conclusively presumed to know the law, and that ignorance excuses no one, as given in the Latin maxim, ignorantia lex non excusat.
If an ordinary citizen should be enjoined as he is to know the law on the ground of expediency, policy, and necessity, with more reasons should a professional practitioner be required to know not only the general laws of the land, but also the special law governing his profession.
Like any other citizen, a nurse may incur criminal liability or subject himself to criminal prosecution either by committing a felony or by performing an act which would be an offense against persons or property.
These menaces have been chasing nurses here and there to minimize legal entanglement and avoid criminal liability. It is sufficient that a nurse must possess a working knowledge of his legal responsibilities.
Today, our group will be showing you some of the many legal issues that have been confronting not only nurses, but other members of the healthcare team.
St. Paul University, Dumaguete, College of Nursing, presents...
Objection! Objection!
Objection! And was admitted to a hospital for a surgical operation. In preparation for the surgery, a nurse anesthetist administered an anesthetic to the patient.
As a result of the injection of the anesthetic, the patient suffered from a functional impairment of her arm.
What then is the liability of the nurse anesthetist to the patient for the resulting injury? That's what we'll find out with this case.
The order of the court session begins. Silence is enjoined.
Let us pray.
Almighty God,
We stand in your holy presence as our supreme judge. We humbly beseech you to bless and inspire us so that what we think, say, and do will be in accordance to your will. Enlighten our mind, strengthen our spirit, and fill our hearts with eternal love, wisdom, and understanding, so that we can be effective channels of truth, justice, and peace. In our proceedings today, guide us in the path of righteousness for the fulfillment of your greater glory. Amen.
Call the case.
Arraignment in criminal case number 7254, People of the United States, Gore versus United States Air Force Hospital.
Attorney Charles Benson Orozco appear as private prosecutor in collaboration with a government prosecutor, Your Honor.
Sumalinok as counsel for the accused, Your Honor.
Parties ready?
Ready, Your Honor. Ladies and gentlemen, Your Honor, I present to you Mr. Cuevas, the nurse anesthetist of United States Air Force Hospital. So, Mr. Cuevas, where were you on April 12th of this year?
I was in the hospital for that scheduled operation.
And on that day, at exactly 4 p.m., you had your operation with Miss Gore, right?
Yes.
So, can you please tell us what happened?
That day, there is a scheduled operation. But before that, let me share to you that I have been serving that institution for 20 years as a nurse anesthetist, and I know what I'm doing. I injected sodium pentothal into the left arm, and when pain was felt, I aspirated and transferred it to the right arm.
I am written basic level C nurse anesthetist. So prior to your operation,
I'm going to inject you an anesthesia into your left arm. This is sodium pentothal. This will cause a slight discomfort, and just tell me if the pain is not tolerable. Okay? How are you feeling today? Okay. Miss, is everything alright?
The pain is no longer that tolerable. It's getting sharp and stinging.
Okay. Okay. I'm going to transfer the injection. How was it, Miss?
Good morning.
Good morning, Doctor.
Good morning, Miss Gar.
Good morning too, Dr. Roscoe.
How are you today?
Well, I feel a lot better now.
Very good. Let me check your incision site. Okay. It's good to hear that you feel all right today. So, nurse, I'll be discharging you this afternoon. Okay?
Thank you so much, Dr. Roscoe.
You're welcome, Miss Gar. So, see you around. Take care.
It's already 7.
Huh? I need to go now. Ouch.
Are you okay?
No, I'm not.
What happened?
Every time I move my arm, it hurts. I need to see my doctor.
Good morning, nurse. This is Dr. Tashana Kanyera.
Doctor.
Tashana Kanyera.
Yes, Miss Earl. I need to see.
Thank you.
Good morning. Good morning. Is Dr. Cuevas around? Yeah, she's around. Good morning, Dr. Cuevas.
Good morning. What can I do for you?
I came here because I have a problem with my arm. Every time I move, it hurts.
So then, let me check it. Is it painful? Miss Moore, since your problem is in your arm movement, let me then refer you to Dr. Fidel. Okay.
My dear sister.
Oh, is that your sister?
Yes.
What happened to her? She's trembling and she's shivering.
Yes, I guess this is the result of her suicidal tendency.
Oh my
She
God.
tried to kill herself
Why?
since her BF tried to lap her.
Tried already.
Yes.
But where is his boyfriend now?
He's gone. I think he's unsatisfied with her.
Oh my God.
How about you? Why are you here?
Oh, I have only fever and cough and colds. You know, but I'm going home.
Okay. How about you, miss?
I think I have a problem with my arm.
I think I need to call the doctor.
To this. Oh, it's the operation. Good morning, everybody.
Morning, doctor.
So, Miss Gore, how are you
Okay na ka,
feeling?
miss.
I'm very much happy now. The pain no longer persists.
Well, actually, what happened was your muscle tissue of the left arm was damaged and it was replaced by a scar tissue.
Observed that by expert testimony, it was averred that the course pursued in administering the anesthetic sodium pentothal and the subsequent treatment by the nurse anesthetist and the operating surgeon were in accordance with the recognized practice of the skillful and careful nurse anesthetist engaged in the specialty of anesthesiology. On the basis of aforesaid findings, the court held that there was no negligence on the part of the physician and the gynecological surgeon, therefore not guilty.
And furnishing formalin instead of Novocaine solution.
A case which accentuates the importance to a nurse of executing the doctor's order carefully and conscientiously. Is the nurse held liable for her negligent act?
You have a small dermoid cyst in your pelvic region, and we have to remove it as soon as possible.
So what do you mean?
I think we have to do a minor operation.
Okay, doctor, do whatever you want as long as it's for the better.
Nurse,
Yes, doctor.
kindly prepare a minor set. We'll do a minor operation.
Hey, doctor, what anesthetic are you going to use?
I'm going to use 1% solution of Novocaine.
Okay, doctor. I guess that's it.
Set now ready?
Yes, doctor.
Okay, anesthesia please. Just relax, ma'am. I'll now inject the anesthesia. Wait. This is not. Miss Cuevas, this is formalin.
But
Give me my Novocaine. Please, Novocaine.
I'm sorry, doctor.
Sir. Okay, we're done.
Maybe by your lesson. Hi.
Hello?
Hey, I'm here. I've been waiting for you so long.
Bye. I have to go. Bye.
Let's go. We're
Guys, how are you?
Guys, we're late. Let's go.
Hey, what's wrong?
Ouch, my pelvic area hurts.
Really?
Ouch. Yeah.
Maybe we should go see a doctor now.
Yeah, come on, let's go.
Hey, let's go.
Arraignment in criminal case number 5110, Harlan versus Bingo.
Good morning, Miss Nurse.
Good morning.
Where were you when the incident of administering formalin happened?
I was in the operating room preparing the medication.
So you aren't aware that what you have actually prepared isn't Novocaine?
I am aware, but I don't know
Weren't
why.
you reading the label?
I am reading the label,
And what
but
does it?
I am unaware that it was Novocaine and it has formalin.
The court held that the nurse, in performing her duties in the operating room, was acting for her employer, the hospital, and not for the operating surgeon, who cannot be held responsible for her negligent acts. Premises considered, the appellate court affirmed that the verdict against the nurse but reduced the damages awarded to the plaintiff to $500,000 and accordingly remanded the cause to the trial court.
Thank you and goodbye.
A young man sued for the amputation of his leg
which resulted from the development of gangrene.
and allegedly negligent orthopedic treatment of his broken leg.
Is the hospital liable to the plaintiff?
In criminal case number 2287, Darling versus Charleston Community Memorial Hospital. Dr. Samson, please put your left hand on the statue of justice and raise your right hand. Do you swear to tell the truth and nothing but the truth?
Yes, I do.
State your name, age, work, and residency.
I, Katrina Samson, 25 years old, orthopedic.
Dr. Samson, you are the one who handled Mr. Darling after the surgery, right?
Yes, attorney.
So I am right when I say that you were the one who gave him the therapies after the surgery.
Yes.
So can you tell me and to the people present in this assembly what really happened?
Actually, I really don't know what happened. It was just that I just gave him therapies, but then it turned gangrenous. So, but this was what happened.
What happened here?
An accident.
Wait, carefully.
Transfer the patient.
My leg.
Sir.
Okay.
Sir, are you alright, sir?
Nurse, get my nurse.
Yes, doctor.
My leg.
No, it's okay, sir. Just calm down, sir. Everything will be fine.
Sir, I place the monitor. Okay, try to stop the bleeding.
Yes, doctor.
OS,
So okay to NSS. Allah! Dry.
You need more gauze, doctor?
Ah!
More gauze, Mr. Darling? Just calm down, Mr. Darling.
Okay, I'll stop the bleeding.
I'm doing it, doctor.
Mr. Darling, calm down. I'll suture your wound. Anesthesia. Nurse, anesthesia. Here you go.
Mr. Darling, just breathe in and breathe out.
Mr. Darling, this is anesthesia. So, how's Mr. Darling?
Well, he's actually recovering.
What about his laboratory results? Okay.
both in the hospital. Can't not. Okay, I'll talk to the other one. Miss, what's your diagnosis?
Did not get diagnosed.
I see. So you need a diagnosis. Okay. I will sleep now since you're not talkative.
Ah! Damn, painful. So painful.
What's wrong?
Doctor!
I think he's crazy. Crazy.
Ah!
It's okay.
Doctor!
I'm here.
Ah!
Is it really painful?
What's happening with my leg? It keeps on bugging me that I wasn't able to sleep last night.
Darling, just relax, Mr. Darling.
It's so damn painful.
Okay. It's just okay.
Haven't you got any morphine there to relieve my pain? Ooh.
Mr. Darling, as much as possible, we don't need to use morphine. I'll just give you mild analgesics to relieve the pain. Anyway, I'll refer you to Dr. Samson. She is a good orthopedic doctor.
I hope this will work.
Hey, come on, Mr. Darling.
Hey Doc, good morning.
Good morning, good night.
Ow, sorry Doc. Okay.
Okay, so how are you feeling with your walking therapy?
Well, of course, it hurts sometime, but I can still tolerate it.
Okay, very good. So, you have finished your first therapy, which is the walking therapy. Okay, we'll proceed to the next therapy. Are you ready?
And what is that, doctor?
The basketball.
What?
Very nice. Yeah.
Basketball with this leg?
Okay, so I'm going to call your coach. Mr. G!
Coach!
Coach, Mr. G! Mr. G! Okay, so this is Mr. Chi. This is Mr. Darling, our patient,
Good evening,
and
coach.
he will teach you the basic basketball skills. Okay?
Are
Okay?
you ready, Mr. Darling?
I hope so.
Okay, let's do it.
Let's go.
Hello, Mr. Darling. As you can see, we're having our practice in basketball. So first things first, you need to know the basics now. First, in defense, you do like this. Defense. Okay? Then try to jump.
Ouch!
Okay. Next is shooting position. Hold the ball like this. Imagine this is the ball. Then, which are you? Are you right-handed or left-handed?
Left-handed.
Okay, opposite side, hold the ball, then point, aim, then try to shoot. Next, so let's proceed, let's try to act it. So let's jog, come on.
Ow.
Hello guys, I have a new project for therapy for basketball. Need to teach this guy. So allow this guy to take a shot first. The ball. Shot, go. Come on.
Shoot, darling.
Try another one.
Good morning.
Good morning, doctors.
Can I see the chart on Mr. Sure. Come on. Where's that room? There, doctor. Good morning. Mr. Darling.
Doctor?
Okay, I am your orthopedic. I am Dr. Samson. Okay, can I see your leg? Oh, what happened?
Doctor, what happened to my leg? I thought you were going to treat it. Now it's going complicated.
I don't know what happened, but it turned gangrenous. I think I have to schedule you so that we're going to amputate it. So to prevent further complications.
What complications?
The court held that the hospital was liable to the plaintiff.
Thank